set the board, like give me some key things so that I can go, grab, look, review, give me 10 seconds to review this, walk in. How do you remember that, right? So you become this team that becomes a superpower.
They're servant leaders. They're behind the scenes, and they allow the space for people to grow into. And I think that's a really important comment.
You got $50 from 60 people. Like that puts you in a whole different bracket of like compensation. You have to quantify these things and bring the value to your pages like you do your team. Today's team. Look, you're on vacation. You have the ability to make a lot more than your base salary or hourly if you're an A player.
The reemployment rate is like 95 or above. That's the one thing that relates to the most healthy, productive, profitable business out there.
The DSO sits above and the profits flow up. It allows the marketplace to become the world for your practice. So your valuation can go up.
It's actually been really great.
Yeah.
It's really been great to get me past some of the plateaus and obstacles I've had in my practice growth and development.
And I've been blown away by both of them. I've been studying from afar, I've been learning from them, and they both are incredibly genuine people, it seems like, and they want to help. And so when I heard they were putting on an event at the last Voice of the Dentistry, they made a mention of it. I walked up to them and said, I'm going to be there.
And a lot of people here are the same way. I think that's why this is such a cool summit. It's different than any other CE because it brings like-minded people together. And I hope they throw it again next year because I'll be here.
Hey everybody, welcome back to another edition of the Bulletproof Dental Practice Podcast. Today, Craig and I are very excited. Well, me more than Craig because I have a personal relationship with this next guest. He is my personal doc. Dr. Lynn Flowers is on with us. He's an anti-aging and regenerative medicine specialist. He's got a fellowship in regenerative. Doc, that's a mouthful. How come I can't say that?
Regenerative.
There you go. Thank you. See, that's why I have a co-host. Your lucky doc is just for that. He's got my six. And
always
functional medicine. Also my personal doc. And I was on the phone with him the other day for a long, I guess it was a phone call. We were following up on some of my labs, and I was like, what other time do people get to spend an hour on the phone with their doc and just answer all sorts of questions and such? And then I was talking with him further, and I said, hey, do you see clients like outside of Atlanta? And he's like, absolutely. We have them like overseas and all sorts of stuff. I was like, you got to come on the podcast. I think dentists will benefit from hearing what you're saying. So without further ado, Dr. Lynn Flowers, welcome to the show.
Great. Thanks very much for having me on the show. And as we talked about the other day, this kind of medicine really came about from my search for health and wellness, and actually my family members. My father had Parkinson's disease, and so I started researching ways to help him where conventional medicine wasn't doing the job. It wasn't taking care of him. And I really discovered a whole area of science that's looking at the regenerative part, and actually what I call interventional preventive medicine. So there's very good science that looks at what keeps us healthy and well, not just what makes us sick.
So what is the breakdown between how you practice? So like, what's the difference, I should say, between like integrative medicine versus like traditional medicine?
So part of it is that we're looking for tools that are not just drugs or surgery or medications. So we're looking for a more natural and holistic approach. But it's also how we go about it, just kind of like what you talked about, spending the time, doing a more comprehensive look, knowing what the person is about, what they're going through, what their environment is like. And like in your case, what do you do for a living? So that can really tell us a lot about what problems and diseases you're more likely to encounter based on that. So it really takes a more comprehensive look at the whole person.
I had thought over my years, that I had a very comprehensive look at my healthcare. And until I went through the panel and kind of got my eyes wide open to some of the things that you suggested we track based on the occupational hazards that I had, it was kind of eyes wide open and I couldn't unhear kind of some of the things you were saying. What are some of the biggest, we can use me as kind of a litmus. Like, honestly, I'd never had my cortisol or my hormones tested from a stress component. And I think Craig can attest that dentists are probably one of the more high stressed subsets of occupations,
Absolutely.
simply because Craig and I joke that our success and our failure are measured in millimeters versus like, oh yeah, I did a good job.
Micromillimeters, actually.
Micromillimeters, right?
A millimeter is an overt failure. A micron is a pretty large failure.
Yeah, and we're dealing in, a high stress and on time, and dealing in a wet 2-inch by 2-inch square that we have to keep dry. It's just like, so I think that's why my cortisol is off the charts when you finally measured it, which was explaining a lot of the reasons why I couldn't sleep. I couldn't, all these things. So I'm not trying to hijack kind of where you want to go with this, but I think that's kind of a good place to kind of interject, especially in dentistry, the stress component and making sure, so talk about that for a second. The lab measurements and the cortisol and things that you track that maybe the traditional doc or the family, the town physician wouldn't be tracking.
But before you jump into that too, I just want to draw one like kind of contextual idea around this whole concept. It's like in medicine, and I say this a lot, so for those who listen frequently are probably going to know this already, but in medicine, the doctor is typically focused on getting patients unsick. The demands on the healthcare system, like Pete was mentioning, he spent an hour with you on the phone. The demands on the healthcare system is that we have a rationed system. So everybody gets a portion of healthcare. We can't afford to give true healthcare to everyone.
Because of time, you mean?
Because of time and the constraints in the system and stuff like that. So medicine in its form now is focused on getting you unsick. So if a guy like Pete or I show up to the traditional medical doctor's office, so like, what's wrong with you? Like, well, nothing. Well, get the hell out of here. Call me when you're sick. And in dentistry, and this is a dental podcast, we focus on getting people optimally healthy. So when you show up and you're a mess, we get you up into good health. And then when you start showing up for routine care, we start talking about elective stuff and getting you even more optimally healthy. And it's really very much alike. Your business is very much alike the dental model in that you're taking people who are otherwise healthy, nothing wrong. They have no chief complaint, or the chief complaint may be something like, I'm tired all the time, or, I have a little cough or something like that, but they're not really, really sick. So it's cool that you have a very similar model to the dental model where you're getting people optimally well.
I like that.
Sorry.
Yeah. And you can come not sick. So I see a lot of people that they're not sick. They want to be healthy and well, or hey, their father had a heart attack and they see the handwriting on the wall, or they have family history or cancer or whatever it is, or they just see the changes in aging, that they're slowing down. They don't handle stress as well. They're getting overweight. They're tired. Their sexual performance is off. And so all of those, to me, though, are critical medical signs that there are changes that are coming up that are setting you up for disease. So this whole concept of anti-aging is actually anticipating what's happening with our body and what's making us more susceptible. What are the most likely things to go after? And so that's why that's important as well. And then part of that is, like Peter was talking about, the stress reaction and cortisol. So when we look at this thing called the neuroendocrine theory of aging, we age more rapidly when our hormones decline. And most of our hormones decline as we age, whether it's testosterone or estrogen in women or growth hormone or whatever, except for two. And actually, insulin and cortisol are two of the common ones that actually increase as we age. Those are the things that increase our aging. They disrupt our glucose control and glucose metabolism, which is another place where we look for optimization. So the stress response is critical. And so it may not even be perceptible. Sometimes people, they say, well, I'm really busy and I don't sleep much, but it's because I'm busy and I don't, their life is not this stressful, but it's the chronic stress that's actually causing biologic changes that, if not corrected, is going to accelerate their aging and lead to disease.
Because it wears out the endocrine system, you're saying?
Well, it wears out your cellular health. And so you need cortisol to live. You need a normal amount to run from the tiger when there's danger, but you kind of live in this flight or fight state constantly, that cortisol. So then all your cells and your brain is just bathed in all this cortisol. So then that disrupts all of that. Cortisol is a catabolic hormone. So it breaks down your tissue and starts to rob your protein from your muscles, and also even affects your brain function. So when you're chronically stressed like that, you become fuzzy-headed, your memory's not as good. So we have to find ways of natural medicine to help with that. But then as we talk about, we teach, self-awareness. What is going on in my life? How do I learn ways to train my brain to calm down and to repair. And then of course, you know, we'll talk about this probably in a moment, but nutrition is sort of the foundation of all of that when we come and look at your overall health.
Yeah, it's amazing. Not only does what you think about affect your physical health and your cortisol levels, it actually affects the ability to solve problems and your mental capacity. I mean, it's like if you're in a stressed out state, and there's that, you know, that Gary V hustle idolatry that's going on, like that. The achiever now, people brag about how hard they work. Oh, you know, I haven't taken a day off in 10 years. No, I haven't taken a day off in 20 years. Like, it's almost like it's some badge of honor to wear that you're working and struggling so hard and that you're hustling. I think it's unfortunate what we're looking towards.
Yeah, huge reduction in your productivity, you know, so if you just go, then you're never restoring, you're never recharging, you're never letting your brain sort of calm down to refocus. You're just basically running on the wheel, and you're never really getting anywhere, you know. So it's interesting when we look at kind of a bigger picture of health and wellness as that's a part of an asset for you, right? You know, we always think about our business and our business plan and financial assets, but your health is the most important asset of all, and it's really the most critical. You know, because if you lose money in the stock market, you can usually recoup that or go out and make more money, but you lose your health, you can't just go buy more health, you know, so that's a critical piece of that.
So when you have someone that comes on, like, why is your panel so thorough? And like, what are the top 3 things you think that people should be looking at that, and it can be related to dentist or maybe, but what are some things that you see like that are not being tracked in traditional physicals, if you will, and then that are eye-opening for you?
So just thinking about our health and aging in general and what accelerates that. And so there's just kind of these recurring themes in health and wellness and disease risk that occur. Inflammation. And so some people even have called this term inflammaging. So they kind of combine that. So inflammation, uncontrolled, it can be silent. And so we've got to check those levels. You don't always realize that that's going on. So that's hurting our cells.
And what are the markers of that you track? Like
so typically we look at things like C-reactive protein. And so we look at the HS C-reactive protein, which has been well correlated with cardiovascular risk. We look at something called LPPLA2, which is actually looking at blood vessel inflammation. And then one of the other ones we commonly look at is fibrinogen. So those are ones that are easily measured. A lot of the standard labs will actually get those too. There's probably a dozen more that some of the specialty labs can measure, but commonly that's the ones that we're looking at.
So it's kind of like the overall thermometer of inflammation in your body, almost. If you kind of just get you an idea of like kind of, that's the best way I've been told to kind of describe it, is that, you know, inflammation is the source of all illness almost.
Oh,
right?
Oh yeah.
And that's one of Lynn. That's what Doc. Well, that's one of the big correlations between untreated periodontal disease as well. So people that are going around with active gum disease, that LPLA and C-reactive proteins are circulating through your body. The amount of contact between the gingival epithelium, like all the surrounding tissues of all the teeth, if you like laid it out linear, it would be like the largest wound entrance or entrance point into your body ever. So it's a big thing. Sorry.
Yeah, not surprising why the dental health is seen as a health or risk factor for cardiovascular disease. Definitely is coming from that area. And many times, one of the panels that we do when we're looking at advanced cardiovascular panels, because cardiovascular disease is still the biggest killer, right? So a third of all deaths are going to be related to cardiovascular disease. But the things that we do that we're looking out for, like inflammation, the other one is oxidation, so hyperoxidation. And then the third thing is glycation, so glucose control in the body. So if you don't have a handle on all those things, not only does that increase cardiovascular risk, but interestingly, that's a thing that increases neurodegenerative risk, right? So the cognitive function, when we look at aging, so there's physical and there's mental, and then of course emotional, so the stress part of that. So as we age, those are the things that are going to impact our quality of life. and then the other kind of different concept that we look at is not just your lifespan. So longevity is good. We think that we're probably helping to improve that, but I'm looking at health span, right? I want to increase my years of productivity and good quality of life, activity, mobility. I want to have my brain function good. And so I want to do that for as long as possible. And so those are kind of the top three things that are really going to influence all of that.
So I had cut you off when you say, when I said, what are you measuring? And so you went with inflammation, and we jumped right into this. What were some of the other ones you just mentioned?
So for oxidation, we usually look at something called myeloperoxidase. So again, and that marker has also been correlated with cardiovascular risk. And so that's a gauge. And then of course, glycation for that. So most of the time now, you might get a fasting blood sugar in a regular panel, but and right now, sometimes they're not even looking at your hemoglobin A1C. So fasting blood sugar is a snapshot for that day. A1C is looking at glycosylated hemoglobin, looking back 90 to 120 days. So how good a control do you have over time? And then the third test in glycation is that we're actually measuring insulin levels right off the bat. We know that 10 years before people become diabetic, the insulin levels start to rise.
That's interesting.
Say that again. So 10 years before someone has signs of being diabetic, they have
10 years before they're diagnosed diabetic, insulin levels start to climb.
Is this metabolic syndrome?
So that's part of metabolic syndrome.
A part of it.
Right?
Okay.
Insulin resistant. So maybe even before it becomes pre-diabetes, these people are insulin resistant.
So interesting. As you're talking, I'm Googling stuff that myeloperoxidase is an inflammatory marker for periodontal disease. So it shows up before people are diagnosed with periodontal. Yeah. Previous studies, conclusion levels of MPO were found to be higher in rats with induced periodontal disease, confirming the hypothesis that MPO serves as an inflammatory marker for periodontal disease. It's amazing, huh?
So you can pick that up. And this is why probably studies looking at omega-3s, so kind of jump ahead a little bit, but omega-3s are wonderful for bringing down inflammation. And so certainly in that respect too. And so, so that's just one of an easy way to get a reflection on what's going on in the body and what their risks are. And they don't feel it. You don't feel your myeloperoxidase.
Yeah, of course. You don't feel hypertension. You feel the heart attack.
Exactly. So you get the end result after all that's done.
One of the simplest thing that I think you stress to me all the time is how a vitamin D deficiency is pretty much, pandemic in today's society. With people and how important it is as a precursor for almost, so much hormone function and all the things I don't even know about. But I know that, that's one of the things I struggle with is getting enough of that. And can you stress how number one, how simple that is to fix, and then how important it is in just, wellness.
Yeah, and it's pervasive, right? So vitamin D deficiency, if we look and measure the majority of the population, so more than 50% of the population is going to have a deficiency in vitamin D. So vitamin D is associated with so many different things, especially, of course, everyone knows bone density and bone support. Particularly, think about perimenopausal women. They need to have, the best bone density that they can have probably in that stage of life. But it also is involved, very important in immune function in the body. And so that's why when we look at studies at cancer risk and low vitamin D go together. And that's been proven for cancers like melanoma and colon cancer, pancreatic cancer, because vitamin D is essential in modulating the immune system. And then of course, as we age, then we get decrement in immune function many times. And so that's a hugely important and simple thing that we should be doing. It's one of those numbers you should always know. You should know what your blood pressure is. You should know what your cholesterol is. You should know what your vitamin D level is. And those are, easy things.
I always just took that for granted. Like, I go out in the sun and, I drink milk or from time to time. Or, I just figured like that was just like a vitamin that you just got, right? I had no idea it was as, as deficient or pervasive and deficient as it is. Maybe Craig needs some because he keeps coughing in the damn microphone.
Absolutely. Yeah. Well, there's been some studies correlating respiratory illness and vitamin D, right? Because that's
Craig, what's your vitamin D level? Since
6.3 this morning.
There's the cause right there, pal. There it is, right there.
Yeah.
Let's get him a Flintstone vitamin stat.
There we go. Yeah,
Can you
you
make
need
that
a whole
in,
bottle though.
yeah.
He has a hard time taking pills, doc, so we have to get him chewables.
Yeah, I have the Flintstone chewables. Are so nice. The gummies, actually. I got so many questions, man. Yeah, but
Go for it.
this cough sucks. But the first thing I want to talk about is, and I don't want to jump too far ahead because I'm sure you're on this. I don't go to a proactive medical doctor like you are. I go to the "you're not sick, get out of here" guy. And we do have a lot of medical clinics around here that are, one in my town called the Bio Station, and they test your hormone levels, but they're not like this holistic approach. So you can go to your medical doctor, then you can go there to find out if your hormones are low and all that stuff.
Right.
And a lot of my buddies, we're all about the same age. I'm 47 years old, and my buddies are hovering right about my age and older. A lot of them are starting to take supplements, like hormone supplements. And I was always very reticent to want to do that because I thought that, hormones fuel all growths, whether they're, beneficial or malignant. So what's the idea about, is part of your practice hormone replacement or hormone enhancement?
Absolutely. And that's really a cornerstone. So it's not the only thing though. So we put it in context of your overall health and wellness and what your individual need is. Testosterone, particularly for men. So if we track levels over time, so as we age, we lose testosterone about 1% to 2% a year from our 20s. And so it's more of a gradual process. In men, we get what we call andropause. Women get menopause. Menopause is usually more dramatic for a woman, or they know they're going through the change. Well, we kind of gradually just kind of decline, and it's subtle, so people don't really pay attention. And a lot of times the subtlety is actually kind of our energy level, our motivation, our mental capacity. By the time people start complaining about sexual function, that's usually one of the last things to happen to us physically. The other silent things that are happening to us, and I can pick these people out at the airport, at the mall, the belly starts to grow. They get what we call skinny fat. Their legs are really little, but their belly's big. You want to stand up for me and show? So you get a little bit of a dad bod. Yeah, that's it. So that's kind of where that kind of starts. So think about it: chronic stress, high cortisol, low testosterone.
That's
the body. That's metabolic syndrome.
I got it. Okay.
Right. So to me, that's a risk sign for metabolic syndrome.
I agree with you, Craig. I think a lot of people associate putting testosterone in their body with steroids or something anabolic, right? It's like, I'm not doing that stuff. But it's really just
we're chatting. Pete just goes, mute your mic when you cough, and I write F you, LOL. Sorry. No, I'm sorry. I cough right. I'm sorry. It's true. I have a mic in my face. But I worry about that. Obviously I'm sure that
what are you worried about? Go back to that.
Well, are there independent studies that show that when you do hormone enhancement therapy that neoplasms grow, cancer?
It's really a myth about prostate cancer and testosterone, common myth.
Interesting.
Been proven that does not cause cancer. It does not cause cancer.
Interesting.
In fact, the men that got prostate cancer that had low testosterone seem to have more aggressive forms, and they don't do as well as the men that have normal testosterone.
Interesting.
And so there's a Harvard urologist, Abe Morgentaler, and so he actually wrote a great book called Testosterone for Life. So it's not a hard read. It has kind of all the background science that's related to that, and really dispels that myth. But it's kind of a tradition in medicine, so a lot of doctors still believe that. That's kind of what we were taught. You just kind of believe what your teachers taught you in school, and now we realize that, hey, there's really no evidence about this, nothing that proves that. Could it promote growth if you have a prostate cancer? Well, sure. So I would never give a guy that has prostate cancer testosterone.
Mm-hmm.
Good job.
Guys,
and so
he just muted his phone during a call.
That's awesome.
Nice. He's learning.
So there's no evidence that there's a direct link to causing a prostate cancer. But when you're testosterone deficient, it's also, you're more likely to have metabolic syndrome. You're more likely to have that insulin resistance. men are more likely to have osteoporosis. So you think
Interesting.
of women having that, but a quarter to a third of hip fractures are still men. And so those are the guys that I see osteoporosis that have been chronically testosterone deficient.
What about, obviously Pete and I are guys, so I'm sorry to alienate the female listeners, but what would testosterone, well, actually it'd probably be a factor for women as well, but what would testosterone do to your hair? Won't it allow your hair to fall? Won't it promote?
Well,
hair
if you're
loss?
genetically susceptible, so it's not everybody. So we have, there are tons of people, on good levels of testosterone, no change in hair. There are some people that genetically, if you're predisposed to male pattern baldness. The other thing is doing appropriate dosing and checking levels, right? You want to know what your level is. It needs to be in the normal range. We want it high normal, but you don't need to have, superhuman levels of testosterone. You have to look at the derivatives of testosterone. So that's why we check levels on a regular basis for anybody that's on hormone therapy.
So that's a good point, kind of talking about, optimum levels as opposed to just, saying like more is better kind of thing. So you're keeping it at, so what age do we kind of have that optimum level?
25.
Yeah,
Yeah,
20.
I would
Yeah.
guess.
Yeah, from the 20s, then it's all downhill after that, right?
Really?
But there's a lot of, the body, compensates a lot. So, you may be, 1,000 or so when you're younger, but as it drifts down, you still have normal function until you reach kind of critical mass. And so certainly below 500, we start seeing more metabolic changes with that. Below, say, 400, have a harder time making lean body mass, and then other changes start happening.
So
Yeah,
almost
I'm
like
probably like 250.
without having hormones optimal, like it'd be really hard even with a good diet and good exercise to really show any kind of progress, especially for guys over 40 kind of thing. Is that?
So it's interesting you say that. So that's kind of the first thing I do is like, I look at nutritional deficiencies. Chronic stress lowers your testosterone, inactivity. So I've had people come, particularly 30s, 40s, and I said, I have low T. I feel terrible. I want testosterone. So I'll say, well, let's look at all the other things that could be going on medically.
Mm-hmm.
I've had people almost double their testosterone by getting on a good nutrition, controlling their stress, bringing down their cortisol, getting in the gym.
Okay.
Yeah, I heard like weightlifting increases testosterone.
Yeah, absolutely. So, particularly in a younger male, those are things to do because our whole premise is that we're helping your body restore itself and rebalance and heal itself. It's almost like anything. Then you get to a certain point, a certain age where maybe, testicular function is just not going to compensate anymore and their symptoms. Then that's when we start entertaining what are the ways that we can boost your own natural testosterone. And then if that's to a point, then maybe doing replacement in a physiologic level and monitoring them. That's
Interesting.
The way
So Pete, just a personal question. How often do you visit Dr. Flowers? Is it a once your
blood
wellness
test
thing?
every 3 to 6 months, depending on
Oh, wow.
what we're tweaking. So I get a full blown like big ass panel. Just because and some of the listeners know we've had stem cell people on, and we've talked about my bio journey and such. But I probably I want to know the data. And we're still like after 2 years still tweaking things because I'm not the specimen of health. Especially from a vascular standpoint.
Why do you say that? What's cardiovascularly? What are you?
I just have some my cholesterol is like 400,000. I'm just kidding.
Well, let's talk about that because I know there was historically some really cool research about the HDL or what they used to call
the ratio, and it's more than that even, Doc.
But,
I mean, but it's more than that. It's the particle size, and there's some other markers like the LP that like some things that predispose you. And I have some genetic markers that predispose me because I have my whole genome mapped, right? So I know, and Dr. Flowers did some genome testing, so I know like I'm just predisposed on a whole lot of levels. And so that's my Achilles heel in my health. And so we're trying to fix it. But Craig, the statins made me feel like dog shit.
Well,
like,
what is your cholesterol?
Now it's probably 240, 230.
Okay, got it. And what was the ratio? Were you a lot HDL or a lot of the LDL? Or let's let Doc talk about that. Is HDL actually bad for you now?
So HDL is the good cholesterol. Technically, it helps with what we call reverse transport of cholesterol, right? So it helps to recycle your cholesterol in your bloodstream. So it's kind of a dynamic process. So we make most of our cholesterol. The liver produces most of our cholesterol. We absorb some of it, depending on your genetic type then. So, you know, we went through all those years saying low fat, we meaning the medical community, when really we make almost all of our cholesterol ourselves. Is not as much influence that unless you have a particular gene that's going to make you more of an absorber. So now we have to be selective. That's why we like to know at least I do a short genomic panel looking at cardiovascular disease that helps us figure that out. We even measure markers in the blood. Are you more likely to be an overproducer or an overabsorber or both? Some people are both. And that also changes the way, it should change the way conventional doctors pick a medicine if they're going to use a drug. But of course, we use that to think about
a statin, right?
like a statin or other drugs that block absorption and things like that. We can even look at the genes. So I routinely check for the gene that's going to make you more likely to have an adverse reaction with the statin. Again, something that conventional medicine has access to if they would, but they don't. So I can help people figure that out. And then we tailor it. So it's about individualized medicine based on, you know, what your individual response is and what your, you know, genomics look like.
That's so cool. So is there, I mean, obviously you take out of town patients, but is this a common, is an office or a type of specialty like yours? Well, first of all, what do you call a person like you? You can't just call them like your family doctor, of course.
Right. So we practice integrative medicine.
Okay.
And so integrative medicine has really become a specialty unto its own. In fact, I just completed, there's a fellowship training at George Washington University, first of its kind. And so we just completed that fellowship. And so it's a master's degree program as well. And it was really kind of brought out by the people that came across with the anti-aging regenerative medicine group. So I did the whole fellowship with the American Academy of Anti-Aging Regenerative Medicine, their advanced fellowship. There's a board for that, a medical board for physicians, and completed that. And then some of the faculty from that who've been doing this for a very long time and researching this, they partnered with George Washington to create the fellowship there. So now there's actually a medical board for integrative medicine through the Board of Physician Specialties. And you have to go through one of these certified, accredited fellowships to be able to sit for the board.
That's so cool. I had no idea.
We're trying to make it it's a very academic. We're trying to look at, there's so much out there, which is probably part of the reason why we're talking today. Is like there's so much on the internet and people are talking about all these different things that might work, could work, this supplement. And so in my practice, my job is to help you figure out what's the things that are going to be most effective, to have the best science for, that's safe and is appropriate for you, you know, because there's a lot of stuff out there.
I think what's cool that I really liked Doc's approach was that, you know, it was all data. It was all data-driven decisions, Craig, and individualized based on my data, as opposed to like go in, you see your doc for 10 minutes. It's like, here, try this, do this Crestor because you have high cholesterol, without looking at any kind of markers, anything else, looking at lifestyle, all these things. And so, you know, that just kind of really resonated with me. But it's unfortunate that our healthcare system can't allow that. And, you know,
we don't have one near me, by the way. I put an integrative medicine by me and there's none. We have an acupuncturist. Yeah.
Doc, do you see heavy, you know, I always, as a dentist, I actually at one point in my career had high mercury. And, you know, and not because I was placing a lot, because I was removing it a lot.
Right.
And I was wondering if you've seen any data that suggests that, because obviously that comes with, you know, high levels of mercury comes with an associated depression.
Right. Yeah. Brain dysfunction, hypertension, cardiovascular disease. And that's one of the areas we look at when we're sort of peeling back the layers. And so the other area of medicine that people practice, they call it functional medicine, which that's sort of an approach that we use sometimes as well. And that's looking at all the things like we talked about. What's your environment? What do you do? What could be your potential toxins in your environment? In your case, metals, but also could be chemicals that you're exposed to, and the things that are off-gassing, all the organic chemicals that you use. And so we have specialty companies that we can even look at residuals for those compounds in there. Of course, we do heavy metals testing for that as well. And then we pick the right person. It's not that everybody gets that when they come in. It depends on what
Your
their
occupational
issue is.
hazard, maybe, right? Yeah.
And your symptoms. So if they have chronic fatigue, and we're going through the list of things, and we, like most times, we're looking at what's the most likely things that are impacting you, and we're looking for impact, right? Bang for the buck, what's going to work. But then as we're going through that, we keep peeling back the layers until we uncover, and we're really looking for more root cause things, and not just something that we can
yeah.
give
So
a pill
I mean,
for.
I would personally recommend every dentist should have a heavy metal test, because it's not something that a physician would necessarily put on their panel to say, yeah, let's do this too. And maybe in today's day and age, it's not necessary because we're not placing as many, but there is still the removal, which you do.
We're removing a ton though,
and
Matt.
vaporize, right?
We're
And
removing
that
a ton.
passes the blood-brain barrier, very easily. And I always tell people, I'm like, look, the Mad Hatter, does anyone know why the Mad Hatter was crazy in Alice in Wonderland?
Absinthe?
He had a mercury brimmed hat on, right? And that was the paint that they used. And so, it can
Oh, I didn't realize that.
Yeah.
It's actually mercury poison. That's very
what's funny is patients always ask me, are these, silver fillings bad for me? And the ADA, at least this last I checked, you're really not allowed to tell patients that silver filling, even though mercury is a proven neurotoxin, you're not allowed to tell a patient, as far as I know. Pete, please correct me if I'm wrong. You can't tell a patient that this is your fillings are a neurotoxin, they should be removed. Correct, Pete?
Correct.
So the funny thing is I say, listen, the ADA has some strict standards on what, safety of this. And there's been a lot of conclusive evidence about the World Health Organization and the FDA and ADA. However, if I take this silver filling out of your head, I'm not allowed to flush it down our toilet because it's considered too toxic for the sewer line. I'm also not allowed to throw it in the trash because it's considered too toxic for our landfills. I have to use an amalgam separator to dispose of it.
You have to keep it near your brain.
However, I am legally allowed to put it on your number 3 or 14, which is probably an inch from your brainstem. So toilet is definitely too risky for society, but 2 inches from your brain, no problem.
I think it's good.
So out of the mouth, it's a biohazard.
Yes,
right.
But in your mouth, there's a special coating on the saliva that
good to go.
It's just
and everybody's gown with masks and special suction devices to airflow, and they have this big red thing. They seal it up as soon as it comes out. That's really comforting.
I wonder when. I mean, I don't want to get in trouble, but I wonder when we're gonna, as our boards and our organizations are gonna finally say, hey, we shouldn't be doing this.
Yeah.
I wonder. I wonder when. It seems like it's amazingly quiet, this issue in mainstream society. I mean, people are all up in arms over root canals and that they're poisonous.
The root cause, right?
Yeah.
The thing on Netflix. Have you seen that, Doc? Did you see that documentary that
I've
caused
heard about that. I haven't
the big disturbance in dentistry for good Lord.
But Netflix actually pulled it and scrubbed their website of all reference to it. It was just done. So it was only out for 6 weeks. However, mercury fillings, I'd love to know statistics. How many people are placing silver mercury fillings right now? I'd say more than 50%.
Yeah, I was going to say, I still think it's the most common restoration placed.
And how long does that go on for?
Yeah, I don't know. I know Europe has banned them. And
Japan.
Yeah. But yeah, I agree with you, Craig. And I feel like the amalgam thing is beaten to a dead horse, but
no, it's actually staying pretty quiet, which is
I'm saying but this has been a thing, and I want to keep us on track in terms of
got it.
not get on the bandwagon of how we feel about amalgam fillings. I'm just concerned about the dentists that are placing or have removed a lot or haven't been tested for something that could be, insidious. So, because it doesn't, you have to actually go through a detox. Like I had to go through like a whole EDTA and cilantro. Is that it? Doc?
Cilantro will help
glutathione stuff.
Yeah.
Guys,
am I saying it right?
Why don't you just eat guacamole? Because that has omega-3 and cilantro.
Yeah, it was so easy.
We could put Dr. Flowers out of business. Just go to Chipotle.
That's right.
Extra $1, but it's worth it.
Everybody gets an avocado when they come for their teeth.
The one other thing that I want to break this up into 2 parts. So the next thing we're going to talk about is longevity and biohacks, which is where you'll really see me come alive. But the one last thing I want to talk about, because I always like to draw a correlation, Doc, to dentists and how this can bring value to their lives and what may be or plaguing, whatever it is, whoever we have on the show. And the other thing I was kind of looking at when I was preparing for your talk was, there's something called sitting disease. And Craig being, Craig does more of doesn't sit it for long periods of time, but I do when I practice. Like yesterday I was in a case and it was a 5-hour case directly sitting. Right. And there's, I was looking at how, the sitting is toxic for your body from a whole lot of levels, especially sitting, not getting up with breaks and whatnot. But so not as sexy as a topic, but, what do you hear on that?
Yeah. So just, and that does tie into longevity as well. So our activity in life. So they've done studies looking at people who are very sedentary in their job and they don't work out. They looked at sedentary and they work out. And then the people who have more activity in their job and they work out, that's the healthiest group of people. So even if you're sedentary all day long, but then you do exercise, you're still behind the power curve a little bit compared to the people who can get up and walk around and actually have an active job where they're during the day or moving around. Our bodies are designed to move. Some people say that we're designed to run 2 miles a day, so just think about the species before we were civilized in our cubicles. We were out having to look for our food. We had to search and always on the move, food and water and that sort of thing. But now they've really limited that. We stuck us inside and put us in a chair. So that it's just like with aging. So whenever you go inactive or sedentary, you start to decay. So the people that have the healthiest aging, that's one of the elements of success for that is like continued activity.
Yeah, I was reading
activity, mental activity.
The U.S. News and World Report top jobs. How dentistry and dental hygiene have always been at the top. At least in the top 5. We've enjoyed those awards as of the last 5 years. But when you see the cons listed in their job, the recurring con and the reason why it's not scored higher for hygiene and dentist is not walking enough. Or not moving enough, sedentary. And I also read some interesting research that says, like, of all the exercises that are most linked to health, and I'd love you to punch holes in this, Lynn, if this is not correct, but walking is one of the best. I mean, I don't even think of walking as an exercise. I love when I look at my Garmin and I've done my 12 or 15,000 steps. I feel better those days. But is that true? Is there some really positive correlation just to walking?
So it's activity and it's moving. The 10,000 steps thing, I always hear people, 10,000 steps is my goal for that. The study's not as clear about that. So I don't know of the study that actually proved that 10,000, it sounds reasonable. We all say, well, yeah, that's a good amount of steps per day. But I don't know if the study has been done that actually proved that it was 10,000, but somewhere along the way, it sounded like
it was by
number.
Fitbit.
Could be.
I'm shafted.
But it gives people a goal, though. It gives you a goal,
to
do that. So that's where that helps people move. And that's how the Fitbits work many times, is that it's a motivator. It gives people a goal.
Yeah.
And then the other place that helps keep people healthy and well is community with that. So what they figured out, that if you can have a Fitbit community, if you can make an app, that shows me my friends. You can make an app, even if they're not my friends, a group of people that are like me, and see where I rank on that. That's actually one of the success factors for compliance and
accountability almost.
Well, I want to congratulate all the listeners of this podcast right now, because you're actually doing something that's very healthy for you by enjoying the sense of community of the Bulletproof dental practice. It's actually.
But you are sitting probably when you're digesting.
No, not necessarily. If you're sitting right now, you should get up and move around a little bit. But you're doing a good thing by listening here. You're probably adding days to your life.
Doc, before we jump into the second part, is there anything that you feel like we've glossed over, or Craig and I just pontificated about, that didn't give you a chance to speak on, that you feel like should be mentioned, that would be of value and we didn't cover?
Yeah, so I just kind of reiterate that this kind of medicine is really a health and wellness medicine. It looks for what makes you healthy and well, not just what makes you sick. You don't have to wait till you're sick to come and do these things. These are things that we probably should all do as an adult. And I even see some younger people, 20s, even teens, if I find parents that have all these risk factors, like, okay, I want my children tested, so we can give them a nutrition plan and maybe help them look out for things that they need to be aware of early on, so they never develop, those diseases. And it's the approach. It's looking at the whole person. It's looking at all the aspects that influence our health. And we use something called systems biology, where all of our body systems are really linked. They influence each other. So, we're not just looking at an eye. We're not just looking at a tooth. We're not just looking at the heart. We're looking at the whole picture.
The whole systemic approach. Yeah. That's good. I think, and that's pretty, like Craig had alluded to, that's big in dentistry. We have the whole systemic connection. And so a lot of dentists have that conversation with their patient. Like, look, heart attack and periodontal disease are correlated very strongly, as are some cancers and some, and insulin. There's a sick, what comes first, a rise in HbA1c or a rise in inflammation, and so it's like this virtuous cycle that, so it's really important in diabetics. So I'm glad that, and I have more and more physicians getting clearance now from their patients for surgery than I ever have. It used to be when I'm beginning of my career, never. And now I probably get, 2 or 3 a week from people trying to get clearance.
Wow.
That's cool. I have a question, if you don't mind. Is there any correlation between resting heart rate and health?
Yes, actually. So that's looking at your cardiovascular conditioning. And part of the reason that's true, it has to go back to the stress balance. So even just a change of 5 beats per minute from your resting heart rate is an early sign when people are overreach or overtraining, right? But also conditioning shows a slower heart rate in general. And it has to do with your sympathetic, parasympathetic balance, right? So when we're conditioned, which is part of the reason why conditioning is cardioprotective, is the parasympathetic tone helps to slow the heart rate down. And it relaxes blood vessels. The blood pressure is lower. So yeah, there's actually a correlation, sort of the next step past that. And all like the Fitment and the Garmin people of the world are trying to figure out, how can we give you something called heart rate variability?
What is that?
Heart rate variability is the variability of the distance between your heartbeat.
Got it.
So when we're really stressed, the heartbeat variability goes down and just have a very solid, straight heartbeat that goes straight. There's no variability. Normally, when we're talking, when we're breathing, our heart rate kind of slows and speeds up. And so heart rate variability is another key indicator for cardiovascular health. You've got to have a personal monitor, on your wrist that can measure it so precisely. So that's been kind of a challenge for some of the wrist monitors. So Polar actually has a wrist and a chest monitor that can detect that close enough to be able to do heart rate variability.
Interesting.
There's some apps out there that can help you kind of measure that, to look at that.
Very cool.
So, yeah.
So in general, though, just so I understand, in general, the lower the resting heart rate, the better, or you can't quite say that?
Yeah. So in general, the person is likely to be more conditioned if the your resting heart rate is slower.
Got it.
Like on your Garmin probably, and on the Fitbit, you can get your morning, wake up. If you wear your device to bed, you can get your morning heart rate upon awakening. And that's kind of the gauge, and kind of compare that time. Many of them will graph it out for you, and you can see. So our runners and people that are training, either for Ironmans or marathons, you can kind of see where they are, and they look at their resting heart rate every single day. And if that's climbing, then they've got to look at, okay, are they in a little bit of an overreach situation with their training? And certainly if it's staying high, then maybe they're overtraining. So they need to look at, what their rest intervals are they getting enough protein? Are they on the wrong training matrix? Sometimes they have aggressive goals. I'm going to run a marathon next month. So they put themselves on these sort of rapid pace training, but you got to watch that. So.
Yeah, that's incredible. I remember I was going to run a marathon, a half marathon. When was that? That was in 2012. I had to look at my award over there. And I went to the cardiologist beforehand. It was a really old school cardiologist, like my dad's friend. The place looked like it was just falling apart. I barely fit in there. Like, it was such a low drop ceiling. I'm 6'5", and I said to the guy, I'm like, listen, I want to get a stress test because I'm going to run a half marathon. I just want to I'm not trained. I just ran it. And I remember him just like, get out of here. You're fine. Like, if you can run a mile, you don't need an EKG. Like, it's just, there's such a difference. There's such a dichotomy in what we're talking about, the type of medicine that you're practicing and what is out there. I mean, there in my local area, while we're talking, there's no one here that's doing what you're talking about. No one. And I mean, that's exactly what I've been looking for, that forever.
Yeah.
So I might be flying up to Atlanta.
There you go.